E-learning tumour-stroma ratio. 2 minutes for a better prognosis with colon carcinoma. Dear pathologists, we appeal to you to help us with vital and promising research. At the Leiden University Medical Center, we, a team of scientists and doctors, are investigating whether the tumour-stroma ratio, or TSR, can be added to the TNM classification as an extra indicator. It is our conviction that this method will enable you to offer patients suffering from colon cancer more clarity regarding the type and the aggressiveness of a tumour. But we also believe that doctors will be able to determine more accurately whether or not patients should receive chemotherapy, thus resulting in less overtreatment or undertreatment. The LUMC has developed a method for determining the TSR. In this e-learning, we will gladly explain to you how it works. Your data will determine whether the TSR can be added as an extra indicator. Determining and registering the ratio between tumour cells and the stroma is a 5-step process that takes less than 2 minutes to complete. This is how it works. 1. Select. Choose a section from the most invasive part of the tumour for microscopic analysis. 2. Magnify. View with a 2.5 times or 5 times magnification and find the part with the most stroma visible. 3. Zoom in. Subsequently, zoom in and view that with a 10 times magnification. Ensure that tumour cells are visible on all 4 sides of the area, preferably with as much stroma as possible in between. 4. Estimate percentage. Next, estimate a percentage for the amount of stroma in tens, so 10%, 20%, 30%, etc. 5. Determine and note. If there is more than one area, then note the area with the highest percentage of stroma in the pathological report. When there is 50% or less stroma, we classify this as stroma low and the patient has a better prognosis. Over 50% stroma indicates stroma high. The patient then has a worse prognosis. Why that is the case is as yet not entirely clear. When determining the tumour-stroma ratio, a number of aspects must be taken into account. Attempt to observe an area with as little necrosis or muscle tissue as possible, or preferably even none at all. Sections containing muscle tissue may resemble stroma but must not be assessed as such. Tumours mucinous in nature can be difficult. You may use an area containing mucus. However, you must exclude the mucus when determining the tumour-stroma ratio. Would you like to learn more? Then please go to watchstroma.com for more information.